I am Saiza KB Limakid, your student nurse for today, and you are?
I'm just a Dumopoy, ma'am.
Alright, so we're going to, what we're doing today is I'm going to assess your pregnancy. So the information or the data that will be gathered will remain confidential. So let's start. So what's your name?
Just a Dumopoy.
Alright. Phone number?
0948-127-2416.
Age?
19.
Birth date?
September 28, 2001.
Educational attainment?
College level, ma'am.
Occupation?
Student.
Alright, so your height?
5 flat.
So your weight?
50, ma'am.
Blood type?
O positive.
Alright, so what's the father's name?
Adler Hidalgo.
Alright, so occupation?
He's a student, ma'am.
Age?
25.
So did you already take your pregnancy test?
Yes.
So what was the result?
Positive, ma'am.
So when was your last menstrual period?
Last September 1.
So age of pregnancy?
1 month.
Alright, so pang ilang pagbubuntis mo na to?
First po, ma'am.
So now let's move on and taking your vital signs. So first I'm going to take something. Alright, so it's normal. And now I'm going to take your blood pressure. Alright. Now I'm going to take your pulse rate. So now I'm going to ask questions related to your past and present health history. So, do you have tuberculosis?
No.
Alright, so heart disease,
Wala po.
diabetes,
Wala rin po.
hypertension,
Wala po.
bronchial asthma,
Wala po.
urinary tract infection.
Wala rin po.
Do you smoke?
No.
It's good. It's good. Do you drink alcohols?
Hindi po.
Right, that's great. Did you experience malaria?
Hindi po.
Did you have goiter?
Wala po.
Are you anemic?
No.
Do you have a tooth decay?
Wala po.
Right. So what food do you usually eat?
Fruits, vegetables, and fish po.
So what was your normal weight before pregnancy?
50 po.
Alright. So has your weight changed since a year ago?
No po.
How much weight did you gain since your last menstrual period?
Wala po akong nag-gain na weight.
Have you had a fever or chills except with the cold since your last menstrual period?
Parang wala naman po.
Alright, so do you have trouble with your throat?
Wala.
Do you have a cough that hasn't gone away, or do you have any frequent chest infections?
Wala.
Right, that's great. So Do you have nausea or vomiting that doesn't go away?
Wala.
Right? So, is your tears greater than your normal?
No.
Awesome. Alright, so do you ever have a bloody stools?
Wala po.
Do you have difficulty when trying to have a bowel movement? Right, that's great. And do you experience burning sensations while urinating?
Wala po.
Alright, that's great. So, do you have a vaginal bleeding or leakage of fluid or vaginal leakage? Alright. Have you lost interest in eating?
Hindi po.
Alright, so do you have trouble in sleeping? Do you ever feel depressed or feel like crying for no reason?
Hindi po.
Alright, good. So, is your work bothering you?
No po.
Have you ever thought of a suicide?
No.
Have you ever had a professional counseling or a psychiatric or psychological?
Wala po.
Have you noticed breast pain or lumps or fluid leakage?
Wala.
Right, that's great. So, have you thought about breastfeeding or bottle feeding your infant?
I'm giving a thought of considering the bottle feeding, ma'am, because I have work.
Alright, okay. So, are there any problems or concerns you may have that we haven't discussed yet?
Wala naman po so far.
So, alright, so, okay, thank you, Jasmine. So, the patient is currently in her 4th week, and as I recall through the ongoing assessment, it all went normal, and there is no need for the immediate response or referrals